Earlier this hour, we mentioned that big news from the FDA and CDC urging states to press pause on the Johnson & Johnson vaccine, and also that federal sites would stop using the single-dose shots. And Dr. Mike from the Fox Medical team is here to talk about that. Good morning.
Good morning, Jennifer. How are you?
I'm doing good. How are you?
Well, I'm better now. I'm talking to you.
Well, I should say I'm a little nervous, though, because I got the J&J vaccine on Friday. Should I be nervous?
So here's the deal.
Okay.
6 cases of blood clots have now led, and by the way, 7 million doses were given to people.
Okay.
Basically, the FDA, CDC, just now basically are saying, look, we're going to pause administration of this vaccine until we sort this out, like they did with AstraZeneca, to make sure that these are not related to each other.
Okay.
And so if I got the Johnson & Johnson vaccine, one, I would feel comfortable that I got it. And these cases of blood clots all occurred within about 2 weeks of getting the vaccine. So if you were my patient, I would say, look, if you have any difference in your feeling generally, if you feel like you have a swollen leg or you have a headache, check in with your healthcare provider. But bottom line is that we don't know yet. We have to study it. And one of my favorite phrases, in an abundance of caution, everyone is saying, look, let's pause this right now for the time being.
And we just hope that this situation doesn't affect people's decisions to go and get the vaccine, the other ones that are available.
Well, Jennifer, that's the issue here. I mean, if we're going to get out of this mess, and remember that there are over 500,000 deaths from COVID-19, we've got to get a way out of this nightmare, and that's with vaccination. So what we need to do is make sure that what we are using is safe and effective, period.